Hi, I'm Dr. Christopher Barker. I am a clinical psychologist in the state of New Jersey. I am hosting this podcast called Holding Space, which is something that I think we all need to do for each other at times. Um, I came upon the name because I hear a lot of my patients slash clients, depending on which term you care to use, using the term about being able to be there for someone, being able to hold space, being able to listen and attend and just really be there for someone else without really necessarily having to solve the problem or to change anything. Holding space in this case is about presenting topics of interest related to the field of psychology. They can be serious topics, they can be less serious topics, but by and large, we try to balance some fairly tough topics with some topics that are just interesting. Today, I'm going to tell you a little bit about myself and something that will probably fall into the more interesting category than anything else. I am a member of a group called the Kink-Aware Professionals Network. That's spelled K-I-N-K. We're not aware of kings, we're aware of kinks. And what is a Kink-Aware professional and why would you need one? Um, we have found that there are a variety of sexual interests and sexual related topics that might be defined as disorders. What's a disorder, first of all? When something is a disorder, it causes personal distress or impairment. You find it difficult to work or get by. You may have distress about your interests. You may have distress about your behaviors. So that's one of the criteria for when something becomes a disorder. Also, risk of harm to others. If you're involved in a behavior that causes danger to others, or by exposure to your behavior, others could be in danger, then it becomes a disorder. In other words, it's no longer something that's an experience in your head. It's something that's happening outside in the world, and it could cause distress to others. A lot of times, paraphilias are considered disorders that fall into those categories. And I don't work just with paraphilias, and I'll tell you more in a minute, but let's get paraphilias out of the way first. Paraphilias are atypical sexual interests that can encompass a wide range of behaviors and attractions. There are some common and uncommon ones, and the list is long, my friends, especially when you get into fetishism. Fetishism is defined as intense sexual arousal from non-living objects or specific body parts, such as feet or leather. And one of the criteria for fetishism is that thing has to be present in order for you to achieve satisfaction. It's not just that you like feet. Feet are nice. They look good. No, it's kind of like, no, if I cannot touch, worship, or only stimulate someone's feet, then I cannot achieve happiness. I can't achieve release. That one, there are a variety of fetishes. One of the most unusual ones that I've ever heard of is called pedal pushing. This is people who really enjoy watching, especially women, stepping on pedals of cars, gas pedal, brake pedal. Sometimes in high heels, sometimes in bare feet. Um, Also balloons. I think there's probably a specific name for some of these, but in Latin, I do not know what these would be. For instance, dendrophilia is sexual attraction to trees. There has to be a tree in the room. Exhibitionism is sexual arousal from exposing one's genitals to an unsuspecting person, often in public settings. Sometimes the other person is aware that you're exposing yourself. Sometimes they're not. But for people who are hardcore exhibitionists, they really are counting on the reaction of someone. And that one falls into disorder because you are definitely exposing someone to something that they do not wish to see, I'm assuming. Voyeurism, sexual arousal from watching others engage in sexual activities without their knowledge. So if you're peeping in someone's window and watching them do things with their partners, then you are a voyeur. And again, sometimes this is something that goes unnoticed. Sometimes people will not do that. I guess watching pornography technically would make one a voyeur, but usually it's watching people in the act in person or possibly live streamed. Masochism, a deriving pleasure from experiencing pain or humiliation. That one has some shades of disorder and it has some shades of acceptability. I'll explain in a minute. Sadism, getting sexual pleasure from inflicting pain or humiliation on others. Again, there is a sort of a spectrum on sadism. You can be sadistic verbally, you can be sadistic physically. There's all kinds of pain, and there's some people who are classified as sadists if they're just verbally cruel to their employees or to people that they meet on the street, that sort of thing. People who prank people excessively and create distress can be called sadists. But usually it refers to deriving pleasure from someone's pain in a sexual setting. So that includes flogging, whips, that sort of thing. Now, there are some alternative lifestyles that fall into the category not of disorder, but more of kink. Bondage and discipline it's entirely consensual as long as it's done properly. Usually when people are in a bondage and discipline relationship or master-slave, some sort of power imbalance relationship, they usually have a contract worked out of things that they can do, things that they can say, safe words, accepted behaviors, preferred behaviors, things that you are absolutely not allowed to do, things that you are absolutely encouraged to do. And that can be lived as a lifestyle. I have known some people who are fully functional. In the normal world, you would never know that they are engaged in any kind of unusual relationship. They seem to be PTA moms type, captains of industry. But when they go home, it's something else altogether. I knew one woman who, and this is not a client, this was a personal acquaintance, who was a very high-powered lawyer. She was a shark, for lack of a better word. But when she went home, she would take off her professional clothing and put on something very frilly and allow herself to be handcuffed and leashed. And that was what she enjoyed because she said she surrendered that role that she had during the day that was so stressful. And she allowed herself to be the pet, the desired one of someone else that she knew was going to treat her well. Now, there are probably some people watching this going, ew, but for some people, this is the most normal part of their life. And that's why you need a Kink-Aware professional. And this network includes plumbers, doctors. There are some people who enjoy pain and they will inflict pain upon themselves. I knew one woman who was afraid to go to a doctor because when she was alone, she would whip her thighs with a belt to the point that they were covered in red marks, welts, sometimes bleeding. And she was having serious gynecological issues. She had fibroids, and she had to be really careful of going to a doctor who wasn't going to either have her hospitalized for something psychiatric or call some sort of protective service on her. We have to be aware that sometimes these things are practiced in a safe environment. Usually we do work with a couple on this, because we do want to make sure that this is one of the hallmarks of BDSM relationships, bondage and discipline, sadomasochistic relationships, is safe, sane, consensual. And there can be all kinds of acts that are included in this, but again, this is to be considered a contractual, agreed upon, safe, sane, consensual relationship. I cannot emphasize that strongly enough. And if you go to see someone who is less understanding of what a kink is, they are apt to be treating you for something that may be the best part of your life. There are a lot of people whose problems relate more to parenting issues, that relate more to early childhood traumas, that relate more to work situations. You can have other problems and still enjoy your kinks. One of the uncommon paraphilias, they call it, is paraphilic infantilism, a desire to engage in behaviors associated with being an infant or a young child. The people who do this sometimes call themselves ABDL, which is adult baby diaper lover. They enjoy wearing diapers. They enjoy the feeling of being wet. They enjoy the feeling of having someone change them. They enjoy the feeling of surrendering and sleeping in a crib. It has to be a very large crib, and some people have specially constructed playpens into cribs for this. They enjoy this. They find release from this. They find comfort from this. Sometimes it's a way of making up for a very disordered childhood, but it's not necessarily something that is dangerous or unacceptable. Again, it's not something that you want to do in front of a lot of other people, but there are gatherings conventions, cons, where people gather who have certain paraphilias, and they will attend these and they find like-minded individuals. They do workshops. As part of my training, I also, as part of an interest in working with this type of population, I have attended workshops on how to do knife play, which sounds extraordinarily dangerous, but it actually is not. If done properly, it's usually done with dulled blades. There's no actual cutting involved. There is sometimes the damsel in distress scenario that either the man or woman plays the role of the damsel, and they're tied up and they are restrained, and then they are menaced by their consent by somebody else who has either a knife or some type of weapon. Again, safe and consensual are the key words here. By telling you these things, I'm not trying to in any way downplay or degrade or humiliate people who engage in this sort of thing. There are some people who do this in acceptable relationships, and everyone has agreed that this is what they do and this is why they do it, and it's fine. And it is something that we can work with. There's some people who do come in because they are having problems with this and they want it to be lessened or they want it to stop. We can work with that. But by and large, the people who seek Kink-Aware professionals are people who are looking for someone who is aware of their particular kink and that they just want someone who can understand that and can understand what it really is. Always assess that this really is safe, sane, and consensual. Assess that what they're doing is not a danger to others, that it's not causing significant distress, that it has not, lost them their job or created problems in relationships with other people to the point that they can't go out. Sometimes this dovetails with obsessive compulsive behaviors. There's some things that people absolutely must have in order to achieve sexual satisfaction. And so this is perhaps something that you would want to get treatment for. There are people who are sex addicts, and that is an entirely different thing. There are people who are specializing in that. They're sex therapists, and I know a few good ones. But people who have a sex addiction are either spending their whole lives watching pornography or sometimes engaging in random sexual behaviors with sometimes strangers just in order to achieve some sort of release. But they're addicted to that particular behavior. And that can be a problem. One extreme case that I heard of, a guy was, he had a traveling hotspot in his computer, and he would be driving down a major highway watching pornography with one eye while he was driving. That's a serious problem because you're creating a danger for others. Because if you become distracted for a moment, you can get in a severe accident. These are examples of behaviors that would not necessarily be the domain of a Kink-Aware professional, and I would have to refer them to someone else because I don't specialize in treating sexual disorders. I don't specialize in treating addictions. I do know some people who are very good at that, and I would be glad to pass you on to some of them. What I want you to get from this is that there are limits to expression of sexual desire. There are some perfectly normal, quote unquote, in the statistical sense, because that's what normal is it's in the middle of the bell-shaped curve. There are a lot of people who do things that are not dangerous or destructive to their lives, and they are happy with this. They're happy with this relationship. There may be some other aspects of the relationship that require some work. Communication, early childhood issues, parental issues, that sort of thing. But it doesn't necessarily mean that the kink is the problem. I once attended a training for domestic violence, and this was not too long after 50 Shades of Grey came out. And one of the professionals in attendance raised the question of, well, what about this 50 Shades of Grey stuff? That's domestic violence, right? Fortunately, before I could stand up and shout, the moderators of the panel were saying, no, that's different. That is a safe contractual relationship, even as described in the book, even though that was not terribly accurate still by most people's account. Still, that is something that is not domestic violence. That is the other problem with this, which is that sometimes we can mistake these things for more severe problems, and just because people have whips and chains does not mean that they are necessarily doing something out of control with their partners. It does not mean that they're necessarily causing unwanted. I mean, you could go to the emergency room and you could have marks from flogging on your back, and it could be part of a safe, sane relationship, but it is not going to be looked at well. That's definitely going to get the police called. So again, it's one of those things that people have to be careful what they show and where they show it. But I know there are some people who are abused in these relationships, and if you're feeling abused, if you're feeling that it's gone beyond safe, sane, and consensual, then we do have to report it to the police or do something to make sure that you are no longer harmed by this. Some people start out in these relationships believing that it's all consensual, and then one person takes it too far and then continues to take it too far, and the other person, being basically masochistic, allows it to go that far. And again, this is a problem. So you can see that it's complicated, and it requires someone who has been exposed to different types of philosophies on this, different populations, to be able to handle it. This is why you wouldn't take this to just your average therapist. It's complicated, but again, I hope that this has given you a little glimpse into something that we don't normally talk about, because despite the fact that we seem to be so liberal with so many things, in America, we're really kind of repressed, and these types of topics don't get talked about very often. They certainly don't come up at the dinner table. Well, not the average dinner table, anyhow. If you have any questions or care to make any comments, please feel free to do so. I'm not necessarily advocating any of these behaviors. I am not necessarily saying that they're all okay. What I'm saying is that there are some people who make this work, and for them, it is a kink. It is not a disorder. And for those people, there's someone available who is able to talk to them about their lives while treating this other thing as something else that they do that's okay. Again, it's just an educational sort of look at this behavior. We can go into it in more depth if you have questions. Usually people do. And because there are some people that even at the mention of some of these behaviors, they become aghast. But it is not necessarily something that is dangerous or perverse, for lack of a better word, I guess. You can call it whatever you want to, but is it something that you want to do? Is it something that works for you? Do you have a consenting partner? Then I wouldn't necessarily say that it's a problem. I know I'm going to get mail on this one. But please feel free to make comments, like, subscribe if you are enjoying this type of discussion of psychological topics. And please feel free to email if you have something to say that you don't want everybody else to see. That's fine too. Our email address will be posted at the bottom. I'm holding space for you, whether you have a kink or whether you don't, whether you have a problem with kinks or whether you don't. You know, we're all people. We all have different experiences. We all have different desires, and we all have different tolerances. And if you are unhappy with anything in your life, you need someone who is able to hear you and who is able to hold space for you. And that is what I'm doing here today. So thank you for holding space for me while I talk about this topic. And please tune in again another time. Thank you.